Hi, my name is Dr. Stephanie Idjadi. I'm a physical therapist in the Great Neck location at Reddy-Care Physical Therapy. Today I'm going to discuss 5 different exercises you could do at home for poor posture. I do these exercises with my patients who come in with neck or low back pain. Typically, a lot of my patients are sitting at a desk the whole day at work, and you find them rounded and tight. So these exercises help you open up, stand more upright. So the first exercise that I'm going to show you is called static back. So you're laying down on the ground. You can also do this on your bed if you have a hard time laying down on the floor. And you want to elevate your legs on boxes, or you could stack up pillows. So the point of elevating your legs, you're stimulating the hip flexor muscle. And when you stimulate the hip flexor muscle, that encourages thoracic extension or extension of your upper spine. So a lot of people who work at a desk or have poor posture have rounded shoulders. So this stimulation of the hip flexor muscle forces you to let your shoulders relax and your upper back extend. To encourage increased thoracic extension, you're going to put your arms out at a 45-degree angle from your body, palms facing up. This forces you to retract your shoulders and let them rest on the floor. The next thing you're going to do is just look straight up and take deep breaths in and out. You maintain this position for 5 minutes. If you're too retracted and can't have your palms facing up, you can start with your palms facing down and slowly work your way up to palms facing up. Also, if you notice that your head is turned backwards, or if you can't keep it straight up looking up, you could put a towel roll under your head, and that forces it to be straight, in line with the rest of your body, with your eyes facing up. So this whole exercise looks like this. So you close your eyes, take deep breaths in and out. And just rest for 5 minutes in this position. The second exercise I'm going to show you is called static wall. This is the more aggressive form of the static back exercise that I showed you first. So with this, again, you lay on the floor, and the point of this, you want to get your hips as close to the wall as possible. And you want to straighten your knees. Activate your quads, point your toes up. With your arms at your side, palms up. Take a deep breath in and out, and try to maintain this position. So the reason why this activates increased thoracic extension and opens you up a bit more is because your legs are higher up, and it forces more hip flexion, which encourages increased thoracic extension. Again, if your head turns back, put a towel roll under your head, and the better you get at this drill, the closer you could get to the wall. So I have a little tightness, I can't get very close to the wall, but again, it's something that you can work on, and as you progress, you'll feel better. The third exercise I'm going to show you is called sitting floor. This exercise activates your shoulder and neck muscles and everything that keeps you more upright. So you're going to be sitting against the wall. Again, you want your butt and your upper back, your lower back, to be as close to the wall as possible. You keep your hands palm facing up here on your lap, and your head rested right in the position over there, eyes facing forward, and just relax. Take a deep breath in. Okay. You also want to maintain this position for 5 minutes. Another thing that you need to keep in mind with this drill, you also want to activate your quads and bring your toes up to you. What actually happens when you sit for a long period of time, your quads get deactivated and the anterior shin muscles get weaker as well. So you also want to make sure that while you're sitting in this position, you're keeping everything on the anterior chain tight and just relaxing in this position. The fourth exercise I'm going to show you is called air bench. So with this exercise, you're standing against the wall. You want your heels, your shoulders, and your butt to be against the wall, and your arms right out in front of you. You slowly walk your legs up as you lower your hips. And you stay in that position. You can hold it for 30 seconds and work your way up to 2 minutes. The purpose of this exercise is to realign your pelvis. So let's say when I get into that position, one knee is more anterior, is more in front of the other knee. So let's say right now, I'm over exaggerating it right now, but my right knee is in front of the left knee. That means my pelvis is not aligned properly. So you have to push your sacrum and your butt region back into the wall, realign your pelvis, and hold the position for 30 seconds. Take deep breaths in, arms at your side, palms facing forward. Let your shoulders round back and just relax. The stronger you get, you can work your way up to a minute, 2 minutes, and 2 minutes is pretty much good enough. Last exercise is called standing at the wall, which is very basic. You're just going to stand at the wall. Again, your heels against the wall, your butt and hip against the wall, and your shoulders against the wall. And with your eyes facing forward, straight ahead, arms at your side. And just relax, hold that position for 5 minutes. So I use these 5 drills with many of my patients who come in with pain stemming from poor posture. Either neck pain, back pain, hip pain, it can vary. If you're interested in learning more about these exercises and how you can modify them to use them at home, give us a call. We'll be happy to give you a free consultation and give you more information on how you can improve your posture.